Stroke ischemic infarct can be divided into three categories. Number one is severity, including onset. Number two is territory. And number three is etiology. So what about the severity? You need a history and examination. So the history is within 4.5 hours onset. The examination is the NIHSS score, which is used to assess the severity of the stroke symptoms. I'd recommend looking up NIHSS score online. There is a 2-hour video, which is very helpful. So what does this accumulate to, whether you thrombolyze the patient or not? So if the stroke has occurred within 4.5 hours with a high NIHSS score, the stroke physician will thrombolyze the patient because that leads to better outcomes. So what is the contraindication to thrombolysis? It's bleeding risk. So a CT head is done as soon as possible to make sure there is no bleed. And you have to look to make sure there's no contraindications, high bleeding risk, such as recent surgery, seizures, already on anticoagulation, and the list goes on. Secondly is the territory of the stroke. Now I like the Oxford classification of territory, divided into total anterior circulation stroke, partial anterior circulation stroke, and lacunar circulation stroke. Total anterior circulation stroke, you must fulfill 3 criteria. Number 1 is homologous heminopia, number 2 is hemiplegia, and number 3 is higher cortical dysfunction, such as dysphasia or dysphagia. Partial anterior circulation is fulfilling 2 of the 3 criteria. Lacunar is a relatively milder stroke affecting the deeper blood vessels in the basal ganglia, so your symptoms tend to be milder. Why is this important? It guides stroke rehab and provides prognosis and expectations. For example, if you've had a total anterior circulation stroke, your mortality rate is 50% in the first month. Thirdly, it's the etiology of the stroke. Stroke can be largely divided into whether it's atherosclerotic disease or cardioembolic. Atherosclerosis occurs over time due to plaque buildup, risk factors, type 2 diabetes, hypertension, obesity, smoking, high cholesterol, etc. Cardioembolic is anything from the heart which sends emboli into the brain, which could be atrial fibrillation, a left ventricular thrombus, or endocarditis, shooting emboli. So how do you treat the two? Well, atherosclerotic disease, you give antiplatelet therapy, aspirin, clopidogrel long term. In cardioembolic, you anticoagulate with a DOAC or a NOAC. This explains why stroke physicians do 3 outpatient investigations: 72-hour tape to look for any bursts of atrial fibrillation, an echocardiogram to see if there's a left ventricular thrombus, and thirdly, carotid Dopplers to see whether there's carotid artery stenosis, and if there is, they would consider carotid endarterectomy. Thank you very much for listening. Hope this was informative. So go ahead, practice. And don't forget to subscribe.